Bismillahirrahmanirrahim. I am Dr. Waris. Welcome you all in Healthcare with Dr. Waris. Viewers, I am here with you after a long interval because I was busy in some tough schedule. So today's topic which I have chosen for you is burns. Burns it's a daily life activity which we will have to face in these conditions because these are the routine part of when we play with fire, and fire is very necessary for life also, for cooking, baking and so on. So whatsoever the reasons when we get burns are of thermal type burns, scales, water burns, and with tea burns, and electric shock burns and so on. Today I make clear you, and I am making this video for you is only to alleviate your misconception about the burns. And most of people do that whenever they get burns, they said that we have not put these burned part in the water and we don't apply water on it. If you don't, I say that you must apply, but water should not be cold. Normally tap water you may add, and when you will not immerse the damaged part, means burned part in the water, and then this resistance and the continuity of the burn on the superficial skin may go down, and this damage will go deeper and more deeper, and it will persist on you, and you can get annoying so much time. So you must elevate it, and you will by immersing into water. When the superficial part get burned, so ultimately you have to save your inner parts by cooling down it through tap water. And the other misconception and the tradition which have we seen in daily life, that people must use the butter, the toothpaste and ink and solution of sugar on that part, rather than they are curing this burns and sensitivity of burn. They want to decrease the sensitivity of the burn, but rather they are providing a medium to the bacteria and to grow on the damaged part of his skin, and so much chances of more infections. We have seen this. So I have discouraged these traditions and don't apply these butter, toothpaste and ink and so on, and rather we have to apply Vaseline like creams and silver sulfidizing cream and so on, and soaked with gauze piece. And we have to initiate fluid replacement also. Fluid replacement is very necessary in this, and the tetanus toxoid vaccine you must administer in single dose to that person. And fluid replacement is according to the percentage of the body burnt areas, and most of the parts of body have 9% of each leg, arm, front part of head, and the legs and back. These all the 9 parts. So how much part get burned? According to that, we have to replace the water. Water means ringolactate water. It is formula is on 4 ml into part area percentage into weight of the patient. So we will recover this patient very clearly, and use of antibiotics is also necessary when we see there is the chances of the secondary infection with bacteria. So we are sitting, this is all about my burns, and if you have any curious question you may ask freely. Till then, take care. Allah Hafiz.